Hey all, my name is Chand and I'm a doctor in Washington, D.C. I wanted to talk about how racism and capitalism is responsible for the disparities that we're seeing in deaths from COVID-19. Well, to start off, it's racism and capitalism which actually created the virus. And then it actually puts people at risk in many different ways. And it puts mostly people of color, specifically black people, at risk. It's because of these structures that people, specifically black people, are in frontline jobs such as grocery workers, nurses, home health aides, and they cannot #stay at home. They're on these low paying jobs, they're deemed essential, but treated as disposable. And so you're at risk because of exposure. You're also at risk of severe disease because of racist capitalist policies, which create other diseases such as hypertension, diabetes, because of segregation, where you don't get enough food, or you get poor food, poor water, no water, housing or no housing. And if you're lucky enough to get access to care, because of racism and capitalism, a lot of people don't have access to care and they're going to die. But if you do get access to care, you end up in a hospital, which is essentially a money-making business. It's unsafe. And we're going to start rationing treatments, which basically means the same mechanisms which put certain people at risk for severe disease to be unlikely to live longer are now going to be responsible for taking away resources that we should be giving to them instead. And so you're going to end up with rationing and you're going to end up with more deaths. And so this is in one way to understand how racism and capitalism is responsible for 75% of deaths from COVID-19 in Washington, D.C. It is not biology, it is not personal choices, but instead systems which put certain people at risk for severe disease and then treats them unfairly.